So you discussed, your facial paralysis, therapy and how you were progressing. What did you do or how did you handle when you started to plateau or stop seeing the progress that, you wanted to see?
I continued doing facial therapy for many years, even though actively I only went for probably 2 years consistently. I continued to practice and do things and use all of the techniques from my facial paralysis therapy for many years. And I would go back on occasion every 6 months instead of every month, and I would get some new advice and some new suggestions, and we would do some new measurements. But there did come a point where I was still having far too many issues, and I realized we needed to address them in a more significant way. And with something like facial paralysis, the more time that goes by, the less likely you are to have an impact and to be able to create change after a while. After, if it's really close to your time of injury, there's a window of time that you have to make some progress. And as more and more time went by, my muscles were atrophying more. There was less likelihood that my nerves were going to wake up on their own. And I was having more challenges. As the muscle tone went away and the muscles just started to droop and stopped working, I struggled a lot with choking hazards, because it's not just these muscles on the outside, it's also some muscles on the inside. And so I can only chew on one side of my mouth. If any food gets over the other side of my mouth, it gets lost into a trough, and then it starts to slide down the back of my throat. And so there was a significant choking hazard. And then also the being able to manipulate food and fluids and actually keep them in my mouth. I'm very messy when brushing my teeth. It's okay, no one sees, not a big deal, but it did cause problems for other times. And so we got to the point where I decided to look into some surgical interventions. And interestingly, I actually found my doctor on Instagram. I had been following this particular surgeon for a number of years, and I believed that I would never be able to actually get to him, that it would be too expensive, it would be too difficult. And then COVID hit. One of the good things, at least ended up being good for me, that came out of COVID was this world-renowned doctor who lives in Southern California, and that's where his operations center is. He started doing teleconferences via Zoom, and so I thought, I'm going to give this a try. So I got on a Zoom call with Dr. Babak Azizadeh at the Facial Paralysis Institute in Southern California. And he was able to, kind of examine up close as far as he could see from what the screen would allow. And then based on my history and the movement that I had and the type of facial paralysis I have and the cause of the injury, being the removal of the brain tumor, he said, I actually think that you're a great candidate because you have done some facial therapy, so you still have some movement, and I think that we can just add to that. So that was very exciting to me, and my husband and I talked about it and decided that we did want to pursue this course. And so we started getting things set up. And over the course of the next several months, we got things figured out and made plans so that I could go to California and have some pre-op things done and then have surgery. And then I had to be able to stay there for the continued process and recovery after surgery. And depending on the situation with each individual, there are different kinds of procedures. In some cases, nerves are simply, the best way to think of it is like unplugged, like an outlet. If a plug pulls out of the outlet, it's not going to work until it gets plugged back in. So for some surgeries, it's literally as simple as plugging that nerve back into the outlet. And so you can actually see a change during the surgery. They can see, oh, yep, plugged it back in. Now all of a sudden there's that twitching or there's that movement. I was hoping mine would be that simple, but that was not the case. My situation was that it had been so long that the nerves and muscles on the whole right side of my face just weren't there anymore. They had just gone to sleep and were not going to wake up. So there were still options, but the options were much, much more complicated. And the procedures I've been undergoing in the last years, it's called a gracilis muscle transfer, and they have been taking nerves and muscles out of my legs and implanting them into my face to essentially, just like you would do with a transplant where you take an organ from one person and you give it to another, they're taking nerves and muscles from other parts of my body and putting them where I don't have functionality to try and restore that. So it's a process called facial reanimation, and the first thing they did was cut about an 8-inch nerve out of my ankle. Now, that means I'm not going to have that feeling, that ankle. They said of all of the different places that they had tested and tried, patients seemed to have the fewest complications or issues with that part of the ankle and the foot. So I don't feel my ankle, and I can't really feel the right side of my foot anymore on my right leg where they took this out. But the positive thing is they have been able to reconnect it and put it into my face. So this nerve continued to work because it was only the right side of my face that was paralyzed. So they took the new nerve, sewed it to the end of this one so that it came and connected all the way across my face. And that was a pretty intense procedure. Recovery was difficult because the impact of the procedure was that both sides of my face were temporarily paralyzed, because this one already was, and then when they went in and messed with this nerve, it also paralyzed that side of my face. So for probably 4 or 5 months, I could hardly use either side of my face, which meant talking was a huge challenge. Eating anything, fluids, huge challenge. I lost quite a bit of weight simply because I couldn't navigate the food. I couldn't physically go through the motions. And my sister flew with me to California and helped take care of me and made me protein shakes and mashed potatoes and yogurt and pudding and all of the soft things so that there was as little processing as possible within my mouth, that in order to be able to handle everything. And that was the first procedure. And then we had to wait for the nerve to innervate, for it to wake up so that we knew that it was alive and functioning. And the doctors can only guess at the approximate amount of time. Nerves recover at about 1 millimeter a day. So based on the size of the nerve they took, they guessed. And it ended up taking about 7.5 months. And the way that I knew it was working was when I could tap on this side of my face and I can feel it over here now. And that meant, yep, it's now one big long nerve. So then we went back to California for stage 2, and this one was much more complicated and involved. And this was where they actually took the gracilis muscle, which is a muscle in your thigh, and they took a little bacon slice off of the muscle and tested it, made sure it was the right size, the right thickness, the right length, and then peeled me open from this side, and then they implanted the muscle here and got accompanying nerves, arteries, veins, and put everything in, and then sewed it all back up. And that has been quite the experience. It has now been almost 2 years since I had that procedure done, and we are still waiting to get more of the movement and for some of the nerves to wake up and to innervate. But I have much more functionality than I had before, and I have that additional little bulk and muscle here, which has increased the symmetry in my face, so it's not as obvious as it was before with the paralysis. And for the first time in over a dozen years, I can smile a little bit on my own, and even better, I can kiss my husband again. So it's been a big process to go through all of that, but has it been worth it? Absolutely. If I don't make any more progress from where I am, I would say it's been worth it. But both the doctor and I still have lots of hope that there's more progress to come.